Friends, imagine this. Your cholesterol is perfect, your blood pressure is perfect, your blood sugar is perfect, but you spend 10 hours every single day sitting at your desk, in your car, on your couch, scrolling, watching videos, working on your computer. Here's the surprising question. Can sitting quietly increase your risk of heart disease, even if you're taking all the right medications? The answer is yes. And that's exactly what we are talking about today. I'm going to show you why movement is one of the most powerful medicines you can give your body. And I will teach you the same framework doctors use to prescribe exercise. It's called FITT, F-I-T-T. And don't leave before the end, because I will also explain how exercise should be changed if you have heart failure, blocked heart arteries, atrial fibrillation, or aortic stenosis, or hypertrophic cardiomyopathy. Let's dive in. When people hear the word exercise, they immediately imagine an expensive gym, someone lifting weights heavier than a small car, and the trainer screaming one more rep. So they quietly close the YouTube video, grab a bag of chips and promise, I will start on Monday. The problem is Monday has been coming for the last 5 to 10 years. Here's the truth. Exercise is not a punishment. It is not a torture. You don't need six-pack abs. You don't need fancy equipments. Exercise is simply moving with a purpose. And when doctors prescribe exercise, we are actually prescribing one of the most powerful medicines known to science. Not in a bottle, not in a pharmacy, and no copay needed for this. And unlike many medicines, exercise benefits almost every organ in your body. Your heart, your brain, your muscles, your bones, even your mood. Now that's a medicine worth talking about. The World Health Organization warns that spending too much time sitting is linked to a higher risk of heart disease, diabetes, obesity, and even premature death. That is why reducing the amount of time you spend sitting and moving more throughout the day is so important. But here's the encouraging news. Your body doesn't wait 6 months to thank you. The benefit begins the moment you start exercising. Every movement is a small investment that pays big dividends for your heart. Now the big question is, if exercise is medicine, what's the correct dose? Too little and you won't get the full benefit. Too much might not be appropriate for everyone. Just like any medicine, exercise has a prescription. Doctors call it the FITT principle, F-I-T-T. And it's incredibly easy to remember. Let's break it down. F stands for frequency. How often should you exercise? The answer is most days of the week. Ideally, at least 5 days every week. Don't worry, you don't have to become a professional athlete. You simply have to become consistent. Then I stands for intensity. Now people always ask me, doctor, how hard should I exercise? Fortunately, you don't need expensive watches or complicated calculations to figure this. Use something called the talk test. If you can comfortably sing, you are probably exercising too lightly. If you can't say more than 1 or 2 words, you are probably pushing too hard. But if you can carry on a conversation while feeling slightly breathless during exercise without being able to sing, congratulations, that's the sweet spot. You should be able to talk but not able to sing during a moderate intensity exercise. And that's the prescription for most adults. In vigorous exercise, neither the person can talk nor sing. So that is vigorous exercise. In moderate exercise, person is able to talk but cannot sing. Next is T. The T stands for time. So for most adults, the goal is 150 to 300 minutes of moderate intensity exercise every week, or 75 to 150 minutes of vigorous exercise every week. That's only about 30 minutes 5 days a week, and you don't have to do all 30 minutes at once. You can spread it out throughout your day. And the last T stands for the type of exercise. So what kind of exercise should you do? Many people think exercise means only running. The best exercise could be walking, cycling, swimming, or dancing, or using an elliptical. Sometimes it could be water aerobics. All of these are excellent aerobic exercise, which increases your endurance. But don't stop here. Your body also needs strength training. Strength training could be done by lifting weights, using resistance bands, wall push-ups, or any body weight exercise. Aim for strength training at least 2 days every week. And also don't forget to stretch and flex. Now, if you are over 65 years old, this part is especially important. Don't just walk. Experts recommend something called multi-component exercise. That's a fancy way of saying combine different kinds of exercise, including aerobic exercise, strength training, balancing, flexibility exercise. Because after age 65, one of the biggest threats is not heart disease alone, it's falling. Better balance today means fewer falls tomorrow. Fewer falls mean fewer fractures, which means more independence. That's what we are really trying to protect. Now, you may be wondering, doctor, that's great if I'm healthy, but what if I already have heart disease? Important question. Let's go through the most common heart conditions one by one. If you have had a heart attack, please don't think you should never exercise again. Actually, the opposite is true. One of the strongest recommendations in cardiology is referral to cardiac rehab. Think of cardiac rehab as physical therapy for your heart. Exercise usually can begin about 7 to 10 days after a heart attack. You start slowly walking, then gradually increase the duration first and then the intensity. Light resistance training or weightlifting can usually begin 2 weeks later. The goal here is to safely rebuild confidence, strength, and endurance. If you have had a bypass surgery, cardiac rehabilitation again is strongly recommended. Walking usually begins while you are still in the hospital. Years ago, patients were told don't move your arms for weeks. Today, we know better. Gentle upper body movements guided by your comfort is safe and may speed recovery. Patients may be able to drive after 4 weeks. If you have stable, blocked heart arteries, your exercise goals are almost the same as healthy individuals. Aim for at least 150 minutes of moderate exercise every week, plus strength training or weightlifting twice a week. Now let's talk about heart failure. Many people think my heart is weak, so I should avoid exercise. Actually, when you are medically stable, exercise should become part of the treatment. Exercise improves symptoms, quality of life, and even reduces hospitalization in patients with heart failure. The secret is don't start too hard. Start low, go slow, and grow steadily. That's how strong hearts are built. So what about atrial fibrillation? This one may surprise you. The recommended exercise target is actually slightly high, about 200 minutes every week for patients with atrial fibrillation. Research has shown that regular exercise can reduce AFib episodes and improve quality of life. But remember, your heart rate should be well controlled before you start exercising and avoid extreme endurance exercise. If you have aortic stenosis, exercise depends on how severe the valve narrowing is. Mild disease usually allows normal exercise. Moderate disease usually allows low to moderate intensity exercise after proper evaluation. But if you have severe symptomatic aortic stenosis, exercise is not safe until the valve problem has been treated. Finally, hypertrophic cardiomyopathy. Here's something exciting. The guidelines have changed. Years ago, patients were told don't exercise. Today, that's no longer true. For most patients, mild to moderate recreational exercise is now encouraged. Some patients may even participate in vigorous recreational activities after careful evaluation and shared decision making with their specialist. Here's the most important part of the video. We know exercise is medicine, but like every medicine, there are times to stop. If you develop chest pain or shortness of breath, dizziness, or feel like you're going to faint, stop exercising immediately and seek medical attention. People with an acute heart attack, with ongoing chest pains, heart failure with symptoms, or uncontrolled heart rhythm problems, active myocarditis, or acute pulmonary embolism, or patients with severe aortic stenosis should not begin an exercise program until they have been properly evaluated. So remember, the goal is never to avoid exercise. The goal is to exercise safely. Now, let me leave you with this thought. Most people think that exercise is about living longer, but I think it's about living better. Being able to play with your grandchildren without getting breathless, being able to travel without a wheelchair, being able to garden, being able to dance for your favorite music, and living independently is the goal of exercise. Exercise is not about becoming an Olympic athlete, it's about becoming the healthiest version of yourself. If you enjoyed this video, please subscribe and like Dr. Logic 360 and share it with someone you care about. Thanks for joining me, and this is Dr. Joseph Gnanaraj signing off.